Particularly here in Houston, we are seeing Black and brown women struggling with postpartum depression, maternal mental health, and they are suffering in silence.
Our system is set up to, help you have a baby and support you through having a baby, and then we hand you this little infant and we say, best of luck to you.
I've witnessed Black and brown women really struggling to find providers that look like them. A lot of providers have implicit and explicit biases that they bring to the table, and they struggle to identify and connect.
I first noticed the inequities in healthcare in my very first job, where I was working in a state program with mostly undocumented women and low-income women. And it was very clear from the beginning that if you didn't speak the language, you weren't getting the same type of care. There wasn't very much compassion. It was a very impersonal experience, seeing how women of color were treated, and I just knew that couldn't be the only way we could do this.
My name is Kay Matthews, and I'm the Executive Director for the Shades of Blue Project. I delivered my daughter stillborn, certainly not the outcome that we hoped or prayed for, but it was, right? But I struggled for an immensely long time trying to find help, trying to find assistance, because folks weren't talking about it.
Particularly with Black and brown women, we also have an additional layer of stigma on top that's cultural, that say, well, you're fine, it's okay, you be strong.
No woman should have to suffer in silence. We need more, we deserve more. I needed to know what to say, where to go, who to talk to, and how to get the help that I needed for myself. Shades of Blue is a project that we created to bring awareness around maternal mental health, specifically in the Black and brown community.
To have a safe space for our communities to come to be able to talk about these things is just, it's so important and so needed.
When you walk through the center, you will feel the energy. You will feel like, hey, this is somewhere where I can come, and whether it's catch my breath, get what I need, whether it's supplies or whether it's job. It's just an exciting time.
One of the most important resources Shades of Blue offers to parents, specifically mothers, are the support groups. Support is so important during pregnancy and postpartum. It's a period where we can feel overwhelmed. There's so many changes, there's so much to do. It can be overwhelming, and when we get overwhelmed, it's easy to clam up. It's easy to seclude ourselves and decide, if I'm feeling overwhelmed, then I must not be doing it right. What Shades of Blue offers is community. What Shades of Blue offers is resources when you may not know where to turn.
We had to figure out a way, how can we motivate women to want to get the support that they need mentally, right? If we gave them diapers and wipes and they had to come to a group for it, they got the social side of it, right? And then we gave them what they needed for themselves, and they're able to build a bond. We're building a community, right? Every year we have our postpartum depression awareness walk, where it is open to the community, and you walk at your own pace, because that's how we look at mental health. You go through this journey on your own pace. Whenever you finish, right? In order to bring the awareness that we want to see in the community, the partnerships are important.
UT and Shades of Blue, we have a campus community partnership to help amplify the voices of women, their experiences, so we can improve research and improve resource investment in community. And that community I can define as not just women, but their families. Medical providers, right? Business owners. So everyone has a stake in ensuring that maternal mental health gets the support it needs.
I'm Dr. Alexia McClurkin. I am the owner of the Sports and Wellness Docs. I do use my role in the community to connect women to Shades of Blue. Every pregnant mom that comes through here, we have lengthy discussions. We talk about it. How are you feeling? We also talk to the patients and linking them with Shades of Blue Project and letting them know this is a very viable resource for you that can be very beneficial after you have your baby, and then also now as you're going through your pregnancy.
Or making sure the visibility of Shades of Blue is out there for the public to get to know. We've partnered together on developing a conference, the Black Maternal Mental Health Conference. The goal of the conference was to make sure that we gave a platform not only to research conducted by your traditional academics, but that we also had people from the community come tell their story, their lived experience as true evidence of what's happening to women. So often these stories from community are left unheard, you know? From a provider's perspective or from an academic's perspective, sometimes we just talk to each other and we think if we talk loud enough, the community's gonna hear us. And that is not the case. So Kay has done some powerful work to forge this campus community partnership that we're hoping to build on.
This is a collective effort. It's not just all us, it's us and others. The network and community of women that I surround myself with is amazing. The energy is there, the synergy to change things, to shift into gear when needed is there. And so that's why this collective of women is most powerful because we do work together and we do make shift happen together.